Joining me to discuss the importance of community-based oncologists and urologists working together to treat prostate cancer are urologist David Morris and oncologist Dr. Benjamin Garmezi. So gentlemen, why did you decide to partner with one another when it comes to treating patients with prostate cancer?
Well, as a community-based urologist, we've recognized over the last 10 years that the standard of care for men with advanced prostate cancer has really shifted. And with combination therapies for men with metastatic disease or advanced disease, we really had to incorporate including physicians outside of urology who have a different skill set to be able to deliver all of those potential treatment options.
And so can you explain how the combination therapies for certain stages of prostate cancer impact how you work together?
Well, I think combination therapy really has been the addition of medications on top of a backbone of hormone medication. Metastatic disease at initial presentation, initial diagnosis is usually responsive to hormones, but we've noted that adding in other medications can make a big difference in the outcome for that patient. Combinations adding in other androgen pills and potentially even chemotherapy or docetaxel. The most recent clinical trial really looking at an androgen pill, Nubeqa, in combination with hormone medication in combination with docetaxel has potentially been an option for men with more aggressive forms of metastatic disease at presentation. But obviously you need to talk with your local care team to see if that might be an option that's correct for you.
Can you describe how you collaborate when treating patients with MHSPC? Is there any advice you'd like to share with healthcare professionals who might need to build a similar collaboration?
Yeah, so there's centers that are large academic centers where medical oncologists and urologists are part of the same practice under the same roof in the same building. But in the community where most patients with prostate cancer are seen and taken care of, medical oncologists and urologists are in different practices and perhaps miles apart from each other. So that collaboration and communication becomes essential. What we did in our local community was created a virtual tumor board dedicated to the care of certain malignancies where medical oncologists and urologists can sign on once a week and talk about all the complex cases that might need opinions from both kinds of providers. And that's essential to helping provide which patients should we intensify, as in add in further therapies, and which patients may not need that because their outcomes are going to be really, really good, regardless of what intensive therapies we add or do not add.
Gentlemen, thank you so very much for your time today. Where can folks go if they want to find some more information?
So if you're wondering about screening for prostate cancer, ask your primary care provider. And if you have been diagnosed with prostate cancer, ask your treating physician, whether that's a medical oncologist or a urologist, if treatment intensification is right for you or if seeking out an opinion from somebody in a different specialty is right for you.
Excellent. Doctors, once again, thank you very much for your time. And folks, if you'd like to see this segment again,